Hello friends, I am Dr. Julius, specialist in orthodontics, working in Axon Medica Polyclinic, Rashidiya branch. I have more than 40 years of experience in this specialty of orthodontics. Orthodontics is a specialty of dentistry, deals with the diagnosis, prevention, interception, and correction of malalignment of teeth between each other and between the jaws of upper and lower, and also the malrelationship of the upper and the lower jaws. The correction of teeth when they are irregular should be attempted or done at an early age, by the age of 15 years. Then a very successful correction of the teeth can be done effectively and very efficiently. American Association of Orthodontists advise every child should be taken for an orthodontic evaluation by the age of 7 years. This will help the child to have an early diagnosis of any preventable correction of abnormal habits like tongue thrusting or mouth breathing or any such habits, which would help in the early correction by the orthodontist. We show you some corrections which were done by the age of 7 years, especially the upper jaw growing behind the lower jaw. Normally the upper jaw should be forward, the lower is behind. But due to some reasons of the growth, the upper jaw stays back. And if these cases are corrected by the age of 6, 7, 8 years, we can do a very effective correction and get the jaw corrections very, very well. This portion of orthodontic correction is actually called dentofacial orthopedics. These patients, if they do not get them corrected by the age of growth, especially up to the age of 11, 12, then it becomes more and more difficult. And by the age of 18, we have to go for surgical correction. So it's advisable to take children for an early evaluation by the age of 7 years. As the case illustrates, if you see your child is developing the upper teeth behind the lower teeth, please bring them for early correction. The other problem that most people come across is crowding of the teeth or malrelationship of the teeth. Sometimes severe crowding can occur due to so many factors like lack of space in the arch, due to constriction of the maxillary arch, in turn causing constriction of the mandibular arch. This we have noticed mainly due to abnormal breathing of the child due to enlarged tonsils or adenoids. When the normal oronasal passage is obstructed by nasopharyngeal airway obstruction, this can cause severe crowding because the patient cannot breathe through the nose. He uses his mouth, and the mouth is kept open. When the mouth is kept open, the tongue lies low and the maxilla gets constricted by the action of the outside muscles. We'll show you a case where there's a severe constriction of the maxilla causing a severe crowding of the upper teeth, in turn causing crowding in the lower. These cases can be successfully treated without even removing any premolars, which is a very common thing we do. Here, due to the constriction of the maxilla, we can expand the maxilla using rapid maxillary expanders. We do that so that the maxilla expands, allowing more teeth to be accommodated. So we don't remove teeth, we expand, put the braces first in the lower or sometimes even in the upper, and correct the crowding. We'll show you a case where it is being done in the same manner, and you can appreciate without removing how we can correct this. Or if you see any of your children having similar problem, you're most welcome to have a consultation with us. We have shown the case where it was treated without extraction. If you see similar problem in your children, please visit us for consultation and we will do the needful. Finally, we also show you a case where severe crowding can be corrected by removing the first premolar, where it was mandatory that we had to remove. Cases where we have to remove the teeth, we have to remove one of the premolars, either the first or the second. Invariably, it will be the first premolar on all four sides of the upper and the lower jaws. And then we put the braces, fixed braces, and correct them. We'll show you in the case that is being treated in a similar manner. So severe crowding can either be done without extraction, or some cases it would be mandatory to extract. So the orthodontist would be the right person to take the correct decision. So if you see any of these problems in your children, please visit Axon Medica Polyclinic at Rashidiya for your consultation, and then we will do the best for you.